True success is not in the learning, but in its application for the benefit of mankind. A private care with a public concern. Theptarin Hospital, Bangkok. Who will believe that for 10 years, this lady has had diabetes, a health threat of the Thai people today. Dietary control as well as regular physical activity or exercise has helped her to have better quality of life. Suchinda said that she has participated in the health program at the Theptarin Hospital, according to a friend's advice. I stopped taking medication several years ago, and I do exercise regularly, modify my lifestyles, eat proper diet, and exercise as directed by the doctor. Today, she has an appointment for a physical checkup as scheduled by the doctor. She has also reviewed healthcare practices that she has learned before at this place. As told by the doctor, the results of her checkup are normal. Suchinda is an example of patients attending Theptarin Hospital in Bangkok, which is well known as the private hospital initiating medical care and prevention of diabetes. When I first realized that I had diabetes, I was very worried. But after consulting with the doctor, I was hopeful as the advice was very helpful in treating the disease. I continuously adhere to the appointments for medical checkups and treatment. Today, I am healthy and still exercise regularly. At Theptarin Hospital, the differences in its medical care compared with that at other private hospitals include the medical treatment and disease prevention, focusing on the life balance and sufficiency lifestyles approach through the inner study and change, based on learning for behavior changes or modification from the treatment of illness towards disease prevention and health promotion. Professor Thep Himatongkam, CEO of Theptarin Hospital, said that the stance of Theptarin Hospital on patient care is to inform or educate them about the illness and help them to change or modify their health behaviors. Previously, the patients came for follow-up care and additional medications and then went home. Today, our approach is modifying the patient's eating behaviors as diabetes can recur even after being cured if the patient resumes such unhealthy habits. Communication campaigns have been designed and undertaken using various media directed towards the people to provide knowledge, understanding, and awareness about self-health care to avoid health risks. Thanya Wanapruk, Associate Director of Theptarin Hospital, said that we hope that our healthcare recipients will gain more knowledge and see the importance of disease prevention, leading to positive behavioral modification. Importantly, our hospital staff have to adopt such modification too. We stress the communication approach that can reach the audiences within and outside the hospital. For example, we conduct rallies for the public, with several bases each on different health topics, into which diabetes has been integrated, for fun as well as educational purposes. The highlight is the Center of Services and Advice for Diabetes Control and Prevention, operated by the team of doctors, nurses, and experts in diabetes, nutrition, foot care, and physical activity, as well as the patients. The most important person on each team is the patient, who has to change or modify his or her lifestyles to maintain an active lifestyle that is beneficial for health and recovery from illness. The emphasis is placed on specially educating the patients in a diabetes classroom on a monthly basis, aiming to change the behaviors of the patients and caregivers, and to give counseling on nutritional therapy and foot care. In this effort, the goal of Theptarin Hospital is to help the patients to know about themselves, have normal health checkup results, and check as well as review their lifestyles leading to new healthy behaviors. Based on several years of experience in diabetes care, the hospital has systematically compiled the knowledge and experiences in this matter, serving as a technical coordinator among the public and private sectors in educating the public throughout the country, in addition to running its core business as a private hospital. Professor Thep Himatongkham said that, despite its initial operation as a small private hospital, its big dream is to become a diabetes institution that benefits the country, and with public recognition and sustainable efforts in extending diabetes treatment, including foot care, in a full cycle scale. The hospital also aims to conduct research studies. Their useful results will be disseminated all over Thailand and overseas. All of these cannot be accomplished in one individual's life. Rather, they need successors. Based on its 15 years of experience in successfully running diabetes camps, the National Health Security Office and the Ministry of Public Health has designated Theptarin Hospital as the organizer of diabetes camps and foot care programs for medical personnel from all over the country. Dr. Narongsak Angkasuwapala, Chairman, Diabetes Hypertension Policy Direction Committee, National Health Security Organization, said that diabetes is a health threat of all Thai people across the country. It is thus essential that all health personnel cooperate in the care for people with diabetes, supporting health promotion and disease prevention, as well as risk reduction. The health team at Theptarin Hospital has had extensive experience in networking, sharing the guidelines and experiences in diabetic and foot care, which have been well recognized nationally and internationally. At Theptarin Hospital, the learning model has been developed by its multi-professional health team in collaboration with the Association of Diabetes Educators and other interested networks. The work has been extended from treatment to prevention and lifestyle modification. The team has compiled the diabetes camping experience and established the Behavior Modification or BMO program to encourage the service clients to realize the importance of self-care and modify their behaviors before becoming ill and make the modified lifestyles sustainable for a happy life. As Theptarin Hospital has been a leader in diabetes treatment and prevention for a long time, paying attention to patient education and monitoring, and continually transforming research results into practice for the patient's benefits. The World Diabetes Foundation, or WDF, has recognized the hospital's work and provided financial support for its program since 2007.
I think this hospital is also very, very unique. I can feel, I've only been here one day, but I can feel it's more than a hospital. It's more the philosophy, I think. It's more a completely different way to approach disease, where focus is on education, is on prevention, is on disease management as teams, which I think we don't see much in this world.
With the goal of raising the standard of diabetes treatment in Thailand, the hospital has been playing a leading role in establishing and operating several non-governmental organizations. Moreover, the hospital has been working collaboratively with several other agencies in producing diabetes care personnel for various health facilities in the public and private sectors in Thailand and other Southeast Asian countries. As a result, Theptarin has been recognized by the World Diabetes Foundation as a Diabetes Excellence Center, responsible for training medical personnel from several international countries.